Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we are going to talk about bruising and cosmetic injections. And first we're going to go over how to avoid getting bruising, and then we're going to go over what to do if you get a bruise. So first let me talk to you about all the tricks for minimizing the risk of bruising from cosmetic injections. And this is an important topic because if you really want to keep up your injectables to look as naturally young as you want, and also to prevent wrinkles, you really need to have Botox injections every 3 months, which is frequently. And if you bruise every time, it's really annoying, and you can also start to seem like a klutz to the people that you know when you start making up stories about why you always have bruises on your face. I knocked into the car door, my kitchen cabinet hit me in the face, my dog, etc., etc. It can be funny, but in all seriousness, we really try to minimize the risk of bruising so that people can get on with their busy lives and not have to worry so much about it. The caveat to this podcast is that while we can reduce the risk of bruising, we cannot eliminate it entirely. So it is always best to book an appointment when there are no major events that week in case you get a bruise. So rule number 1 is to avoid blood thinners. Aspirin and baby aspirin are really common medicines that people take that increase the risk of bruising tremendously. And it takes a minimum of 10 days to get those out of your system. So if possible, if you're using them for prevention and you don't really need them, it is best to avoid any type of aspirin for 10 to 14 days before your appointment. This includes Excedrin, baby aspirin, regular aspirin, and really aspirin is a common culprit for bruising. The next most common blood thinner is Motrin, ibuprofen, Aleve, naproxen, etc. And these are often taken to reduce pain and should be avoided for at least a week if possible. Other common blood thinners are vitamin E, which is often in multivitamins. So just in case, I recommend no vitamins for 7 to 10 days. Also, fish oil or omega-3s are very commonly taken, and those are blood thinners. So those should be avoided for 2 weeks prior to an appointment. We have a list of common medications that are blood thinners on our website, but it is also easy enough to do your own search of your own medications and supplements just to be safe. If it is possible to stop them, then I tell people to stop them 10 to 14 days just to make it easier to think about, as opposed to this one for 7 days and this one for 10 days, just 10 to 14 days in advance of the appointment for best results. There are many patients who have to take blood thinners, these or prescribed blood thinners, for medical reasons, and I absolutely can do cosmetic injections on blood thinners. It's not unsafe, it's just a higher risk of bruising. So I tell people to talk to their primary doctors and see if they are allowed to stop their prescribed blood thinners for a couple of days. If they are, great. If they aren't, no problem. We will do the injections anyway. So rule number 2, after rule number 1, which was avoiding blood thinners, rule number 2 is to be careful what you eat and drink. Alcohol is a blood thinner, and that is usually relatively easy for people to just not drink alcohol for a week before their injections. So that's a good piece of advice. And some of my patients also stop eating fish, which are high in omega-3s such as salmon, a week before their appointments, although I think that's a little bit of a softer call. So that wraps up what you can avoid. Now we are going to move on to things that you can actively do to avoid bruising. And the most common advice is to take or use arnica. Arnica is an herb that helps reduce bruising. It comes in little pellets to put under your tongue. It also comes in a cream or a gel. It is widely available. We have it at our office, but it is available at health food stores and some pharmacies. And I find that the pills are best for prevention, but the cream or gel could also be used, and it's best to start it a few days in advance. I don't think there's any exact science to this. I usually recommend around 3 days, but some patients start it a week before, the night before. Some people just use it after their injections, but arnica can be very useful. I find that some patients also like to take bromelain or alternatively eat pineapple, which has bromelain in it, and those are things to do to try to avoid bruising. The last piece of advice that I have on avoiding bruising is if you're in my office to remind me or ask us to please use the AccuVein. The AccuVein is a device that helps me see where the veins are. It's often used for pediatric blood draws or vein procedures, but we've adapted it for use for cosmetic procedures, and it works really well to help see and mark the vessels so that we can try to avoid them. So what I do is I clean the patient's face, and then I use the AccuVein. It shows me where the vessels are. I mark them with an eyebrow pencil that we then can wipe off later. And it works really well for Botox because Botox itself moves about a centimeter away from where you put it. So I can move the Botox a millimeter or two and still get the same cosmetic results. So it's pretty easy to mark somebody's face for Botox with the AccuVein and do the Botox, avoiding the vessels and reducing the risk of bruising and getting great cosmetic results. So I love to do that. But firstly, I'd like to mention that it's not 100%. So there are vessels that we cannot see with the AccuVein. And so sometimes, even though I've used the AccuVein, people still get a bit of bruising. And secondly, I don't find that it works particularly well for fillers. And this is because fillers have to go in a specific spot. You can't move them a few millimeters here or there to get the best cosmetic result. And so I find that AccuVein works great for Botox, but not so well for fillers. But I like to use it for patients who are really bothered by bruising or get bruises very frequently and it bothers them. So it does reduce the risk, but it doesn't reduce it 100%. So now let's move on to what do you do if you get a bruise from a cosmetic injection. First, we apply pressure if we see the bruise happening, which we often will see it right away, and I just press on it hard. I have my staff press on it and try to stop it while it's happening in the office, and that often helps a lot. Once we've pressed on it for a bit of time, a couple of minutes, we will often switch to ice. Ice is a vasoconstrictor, so we will do on and off ice. I don't recommend constant ice. I've seen patients actually burn their skin by doing too much ice, so I usually recommend 5 or 10 minutes with ice covered by gauze or a cloth, and that can be really helpful for reducing bruising. I usually recommend that patients do it 5 or 10 minutes every hour when they are home, not busy and awake. People do not need to stay up all night icing themselves, but certainly ice for the first few hours or day can be helpful. I also recommend arnica. Again, pills, cream, or gel, whatever works best for that patient. Personally, I use the arnica gel when I have injections, but the pills and the cream also work great. So arnica can be very useful for helping the bruise go away faster. Some bruises are really small, what I call little prick marks, and those go away quickly. But larger bruises can honestly take a few weeks to go away, and those can be rather annoying. So we do offer laser in our office to help reduce the bruising, and that is best done a day or two later when the bruise is red or purple within the first few days. It doesn't work immediately because the bruise is not really at the surface at that time. But once the blood has gone into the skin a day or two later and the bruise really shows up, we can laser it, and the laser makes it go away more quickly. I tell people that the laser can cause some redness and swelling on its own. So if it's really a small bruise, the laser is probably not worth doing. And if the bruise is yellow or green, it is not going to work. It only works if it's red and purple. And it also only works on fair-skinned patients who are not tan. So it's limited on who we can use this service on. But it is helpful for some patients, and I try to explain that basically it will take a bruise and make it go away more quickly, usually about a 50% reduction in the time that it will stay. So if it was going to be a 2-week bruise, it'll turn it into a 1-week bruise, etc. The laser is a little bit patient dependent. Some people find it works really well. Other people find it is not worth it, and it does require coming back to the office, so it is not for everybody, but we do offer that service. The other thing to do is wear makeup, and if the patient's makeup is not working well, I recommend the brand Dermablend, which is available at some retail outlets, and you can match it to your skin color, and it's thicker, and it usually works well to cover just about anything. So to summarize, to avoid bruises, try to avoid blood thinners and foods. The common ones are aspirin, baby aspirin, Motrin, ibuprofen, Aleve, vitamin E, fish oil, and alcohol. If you're on prescription blood thinners, you would need to ask permission from your doctor to see if you're allowed to stop them. I do recommend considering taking or using arnica or bromelain in advance of the appointment for prevention. And once a bruise happens, immediate pressure, on and off ice, and arnica are really helpful to get the bruise to go away faster. And if it's possible, we can do the laser. And if all else fails, makeup or a story about the kitchen cabinet or the dog. And remember, please do not schedule your appointment for cosmetic injections the week of a big event in the unlikely chance that you get a bruise. I hope that was helpful. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.